So, hello friends. So, I'll be talking on this article, which I was meant to give a talk in one of the meetings. So I had to pick up a good article in oncology segment, onco critical care. So this was an article which came in 2021 in Annals of Intensive Care by the French group. So this was an interesting study to look at the outcomes in patients who come to intensive care with oncology problems. So the title of this was Pattern of ICU Admissions and Outcomes in Patients with Solid Organ Tumors over the Revolution of Cancer Treatment. So the whole question is to see whether the outcomes have really improved in last decade with the newer advents in the possibly ICU management and the oncological interventions, and to look into the hard data as to what the outcome of these patients are and what are the patterns of these patients would be. So what we have understood is the background. Oncology patients are significantly increasing. The admissions to ICU are increasing. And there are a lot of advances that have happened in oncology where there are more immune therapeutic interventions that are happening and targeted therapy that are happening, which is shown to improve prognosis. And along with all this immunointervention and targeted therapy, toxic complications also have started increasing, needing ICU admission. So that is the sort of a backdrop. So this was a retrospective single center study done over 12 years. So basically we are looking at 2 decades here. As you see, 2007, they have looked at 1 year, and 2017-18, they have looked at 1 year and compared what has been the outcome in a span of 1 decade in oncology patients. And they have looked at patients who come to ICU with unplanned ICU admissions, which means they come to ICU because of some deterioration. And this deterioration could be specifically related to oncology problems. So if there is any solid malignancy, any complication specific to the tumor needing ICU admissions were taken, or the other conditions where they were not related to tumor. So it could be any other sepsis or it could be any other vascular event. So they looked at that. And the third was they looked at procedure or drug associated complications. So because these oncology patients would be on chemotherapy or would be on some interventions or any surgical procedure. So they looked at the complications arising from therapeutic modalities or interventions also as one of the criteria for this particular study. So they evaluated 1,525 patients, and predominantly the solid organ malignancies came from the lung cancers and the GI malignancy. These were the two predominant cancers needing ICU admissions in this particular study. And there were others, but the majority of them were from the lung cancer and the GI malignancy. So the background, as we understand, so anti-tumor immunosurveillance has significantly improved, and targeted therapy on actionable oncogenic mutations have sort of started, which the hypothesis is which should have improved the outcomes of these patients because these are all targeted therapy targeting the oncogenic mutations, and there are immunotherapeutic modalities, and hypothesis is that their outcomes should be improved with these. So this was an older study where they showed 1/7 of all critically ill patients who come to ICU had some sort of a solid organ tumor. So this was a Belgian study. And out of this solid organ tumor, 40% had metastasis. So, and here they showed the ICU patients when they come to the oncology patients, when they come to ICU, 8.8% had metastatic problem when they come with cancers, and only small percentage, 3.3%, were non-metastatic, which means to say the oncology patients coming to ICU predominantly they would have more metastatic problems as compared to isolated tumor problems. So the results of this study, so as you see, this is a very good sort of a stratifying of the patients. So they have looked at 2007 to 8, and exactly 10 years after that, they have looked into the data to see if things have improved. And they have seen that metastatic disease admissions to ICU has significantly increased from 48.6 to 60 point, which means the proportion of or the occurrence of oncology patients has increased, and their admissions to ICU also has significantly increased. And the drug related complications or the intervention related complications also has doubled. So because possibly these patients are being more aggressively treated with lot more potent medications and lot more surgical interventions, so the need for admission also has doubled in last 10 years. And the crude severity of the disease surprisingly has shown to be no different between these 2 decades, 2007 and 2017. But what is interesting from ICU perspective to make note of is the ICU survival. ICU survival, one would have expected it should have improved because of newer advances in intensive care and the newer advances in the oncotherapy. But both of these doesn't seem to have been reflected in this study because the ICU survival is 77.4% and there was no difference between these two decades. So that possibly is a strong signal emerging that despite all the newer advances of immunotherapy, targeted therapy, and improvement in the ICU care, the outcomes, ICU outcomes, survival has not changed. And to that effect, even they looked at 1 year survival, even 1 year survival also, there's no difference. It's 33.2% is the 1 year survival. And over last decade, that also has shown no difference, which means to say, albeit all the advances that we may talk about, the outcomes remain the same. And that is something which may be discomforting or which may be unsettling for us. So now, after this, they have looked at independent predictors of ICU mortality as to what are the rays. So it is quite uh, intuitive for us to think that anyone with a metastatic disease have a worse outcome. So that's what was shown. So anyone coming with distant metastasis, outcomes are bad. And someone with a local tumor progression, where tumor is progressing despite being on treatment, which means non-responsive to the treatment, and the local progression of the treatment also was found to be independent predictor of ICU outcome. So when you look at this mortality, as you see, the highest mortality in ICU was due to the lung cancers. So that was the commonest admission also. This was followed by the breast cancer. That was followed by the digestive tract malignancy. And even after ICU also, they found that mortality was high in metastatic disease as compared to this red line, which is an advanced disease, and then as compared to the localized. So this is also quite intuitive for all the listeners that metastatic disease have bad outcome and advanced disease also has a second bad outcome followed by the localized disease. So, and this was again a similar trends as you see, lung remains the highest mortality. This is after post ICU discharge. Also, the mortality was high in lung, and that was followed by the skin and followed by the digestive tract and the urology. And even post ICU also, the mortality was high, obviously in metastatic, followed by advanced, followed by localized. So they looked at independent predictors of ICU mortality. So this is quite intuitive for possibly all our ICU trainees. So the independent predictors of ICU mortality is anyone who comes to ICU with organ failure. So anyone with an organ failure needing organ support, needing NIV or mechanical ventilation or needing vasopressors or needing renal replacement therapy. All these worsen the outcome or increases the mortality. So this I'm sure every intensivist would agree. And higher the SOFA score, worse is the outcome. These are the predictors of ICU mortality, which is typical for any other ICU patient. Same thing remains and holds good for oncology patient also. And they looked at 1 year mortality. What influences the metastatic disease? Obviously, has a bearing on 1 year mortality, or specific complications relating to the cancer, or someone who has an end of life directive, foregoing life sustaining therapy directive. So they would have higher risk of mortality. And as I said, the tumor progression, despite being on treatment, constitutes an important risk for 1 year mortality. So in the discussions, the author do talk about the short term and one year survival definitely has not changed over 10 years. And here the authors have put it into the positive light that one would have expected with increase in the cancers, the survival rate should have come down. Here, having remained same, they have put it on a more of a positive note. But I would look at it more from a limitation point that there has been, despite all the advances, there has been no improvement in the outcome. And the organ failure support also over last decade, it has shown no change with regards to, with the time, there has been no change with the organ failure support as well. And they have shown that prevalence of metastasis has significantly increased. And we saw that in the results. So the prevalence of metastasis in the cancer patient, which means to say these patients are living much longer because increased proportion of the patients are amenable or subjected to targeted therapy and immunotherapy, which is possibly making them live longer with metastasis. So that's what it means. And this was a meta-analysis from these two studies, from the French group and the UK group, where they've shown that solid organ transplant seems to have improved short-term prognosis at least from all the data that has been collated in the meta-analysis also. So short-term prognosis would be okay. Like we saw 77% is the short-term outcome, but that comes down significantly to 33% over 1 year. So that is what is the conclusion. And as I said, the determinants of ICU outcome was extent of organ failure, type of cancer, and the stage of cancer, and the complications associated with this. And progression of the cancer, despite being on treatment, portends worse prognosis, both short term and long term. And this is important. So authors have emphasized that any patient with mechanical complications or compressive complications, which means tumor invading and compressing the vessels with veno-occlusive disease, has a much worse prognosis. And limitations of this study is it's a single center study, retrospective study, and functional status of the patients was not captured because retrospective you would expect a lot of missing data. So the conclusions of this study, which is one of the recently conducted comprehensive study, shows that although there are good advances in therapy, advanced and metastatic cancers, three-fourths of the patients survive to ICU, but only one-third of them remain alive at end of 1 year. So that is a sort of a message one could keep in back of their mind as to their survival. And advances in management and prognosis of solid organ tumors has significantly improved, but this improvement has not translated in change in their outcome in last 10 years is what we can deduce. So that's the message from this article. It's a good article for intensivists to have clarity on what are the predictors of ICU survival in oncology patients and what has been their general outcome and one could expect in these patients. So thank you one and all.